Well, thanks for joining me today. I had the privilege yesterday of actually taking part in a panel during the executive perspective sessions around this topic. So what I wanted to do today was take just a few minutes and highlight what we talked about on that panel. So as we look through the innovation cycle in healthcare, how do we balance that with security? As we think about that, we really have to kind of think about the current threat landscape. So what is the adversaries that are attacking healthcare? What's that look like? So over the last 5 years, if we look at that, we've seen an over 200% increase in data hacking related incidents and over 278% in ransomware. And that's actually really increased in the last 16 months or so. We've all seen it recently, Change Health, some other entities. But what's kind of interesting is theft and loss and inappropriate handling is still the leading reportable security breach. So when you report to the OCR, it's still the fundamentals that are getting most organizations. So a laptop being left in a car, somebody putting something on a thumb drive and walking out and leaving it in the parking lot, things like that. But the scary trend that we're seeing over the last year, especially, so this is 5 years ago, just last year, 75% of breaches and security incidents that are detected are malware free. So it used to be threat actors would deploy malware in the environment. We would have 3 days, 3 weeks before they executed. We're now down to about 63 minutes from the time that they gain access to an environment before they deploy ransomware or start exfiltrating data. So malware-free threats is phishing, social engineering, leveraging a trusted third party so they may compromise the vendor and then come into your network, or taking advantage of 0 days. So what led to the Change Health compromise. So this is kind of the threat landscape. That 63 minutes is the scariest part, and that's what you have to try to balance against. So when we're looking at new innovation, AI is a very popular topic right now, but it could be bringing anything into your environment. How do you start planning for those security and privacy risks? You really start that with looking at it through a lens of a framework. So you're going to want to look at benefits. What are you trying to benefit as an organization by bringing this new solution in? That could be clinical, operational, strategic, patient safety. But then on the risks, what do we need to start putting controls around to safeguard? That could be patient safety, implementation risks. Sometimes we forget about just bringing it in and getting it set up, those risks that are just a point in time. Ongoing regulation and compliance, and then like the standard security of confidentiality, integrity, and availability. So we want to identify all those risks. We also want to think about ethics. This could be health equality. This could be in the case of AI, where regulations and guidance from authoritative bodies is kind of lagging. So your organization may need to have guiding principles of how we're going to do that ethically. And then just overall principles of your policies, things like that. We spent a lot of time talking about this yesterday about how do you identify this and use these frameworks. And ideally, you want this framework to be business-centric. So it's not just security doing this. You have your risk management, you have your compliance functions, all building this risk framework out. But then how do you balance that? So you have a list of 50 risks or 100 risks. How do you balance it? As you start through the innovation cycle, you want to do a couple of things. Early on, you just want to have a reasonable set of security controls. You don't want to stop innovation from happening. So you may do things to start with security controls or reduce the risk. So in the case of AI, if you're trying to do a proof of concept, just to see if it's viable for the patient care teams or something like that, you may use de-identified data, or you may do fixed prompts in the drop-down for generative AI, so you're getting back a results that you're expecting versus kind of just letting anything happen, so you have more of a control around it. But long-term, you're looking at how do you mitigate those risks that you identify to an acceptable point. Security isn't black and white normally. There's a lot of ground in the middle. Like, you need to enable the business, you've got to get the business requirements and the benefits there from the solution. So how do you work with everybody involved to manage those risks? You still need a baseline security controls like HIPAA requires, but then from there, let's make it reasonable. And then lastly, and this is where we spent a lot of time on the panel yesterday, is what's that ongoing monitoring? Sometimes we forget about the operational aspects. So we plug it in, and then 5 years later, it's still sitting there, but the vendor's implemented a new product, the workflows change, and nobody's using it, and it's just sitting there in the corner now, which has introduced this big security risk. So how do we monitor that and take care of those things? And this can be simple. This could be a 3-question thing that happens once a year to flag for new things. It could be more complex depending on the environment. especially like in research. But we do have to do that ongoing monitoring aspect too. That was the highlights of yesterday. Happy to answer questions. That session is recorded and will be up at the end of HIMSS, so I think next week. I'd encourage people to watch it. It had, I was on it, and then we had people from both the provider and the payer side of the house too, so has some other perspectives too.